Desiree, I can't see who's in this meeting. Do we have a good bunch of the assembly here?
I do believe so.
Okay, then we'll go ahead and get started. So I'm going to call this work session to order on AR 2020-271, allocation of COVID-19 relief funds. Let's start with a roll call.
Ms. Allard? Mr. Constant?
Here.
Mr. Dunbar?
Here.
Ms. Kennedy?
Here.
Ms. LaFrance?
Here.
Mr. Perez-Verdia? Mr. Peterson?
Sounds yummy. Delight them with our fresh baked cookies.
1 second.
I want some of those fresh baked cookies.
Mr. Peterson? Ms. Quinn Davidson?
I'm here. Thanks, Desiree.
Mr. Rivera?
Present.
Mr. Weddleton?
Here.
Ms. Zalatel?
Here.
All right, you have quorum.
Great, thank you. All right, so as usual, if assembly members want to get in the queue, please either put yourself in the chat, or if you can't access the chat, text me. Much like we have been doing with all of our other discussions around the COVID-19 relief funds, CARES Act funds, we can go ahead and keep this discussion informal. Purpose of this discussion today is to review any changes that the administration might have made between last Friday and today. And then it's just our last chance to do a pass through of the list, see if we are okay with everything before we get into deliberation and a vote on Tuesday, August 11th. With that, I'm going to go ahead and turn it over to Jason.
Thank you, Mr. Chair, and I have Chris Schutte is here as well, so he will likely chime in at a number of different points throughout us walking through the S version for the AR and the AM, along with the attachment that they have, is being routed through the new on-base system internally. So that is imminently being approved by all the folks on our end that need to do it before it's put onto the addendum. But without further ado, let me pull up the document for the S version. I will say that we made very few changes to this. So instead of going through all of the items in here, I thought maybe what I would do is run through the changes that were made and why, and then certainly open it up to questions. So I'll try to start from the top and work my way down in terms of changes. The first change that was made was on the AHD capacity side. Once we were able to look at that and run the numbers, that increased a little bit. So there was an additional 300,000 that was added to that item. And then the first first item that was taken out of this proposal is the Healthy Spaces unit for $1 million. We were not able to finish all of the necessary work on our end to get that proposal in a spot that was presentable both to the public and the assembly. So we are still working on that, though. But that resulted in a decline from what we saw last week of $1 million taken out. The next item is the Public Lands Jobs Program. I believe that on Friday that was at about $2 million, if I remember.
Actually, sorry to interrupt you, Jason, but it might be helpful if, as you're going through this, if you could describe why changes were made. That'd be great. Thanks.
Okay.
Can I just follow up to that, Mr. Rivera, Mr. Chair?
Yeah, go ahead, Austin.
Thanks. Jason, I know you described why in the healthy spaces,
Yep.
sort of generally, not specifically, but with the AHD increase, you didn't describe why. Can you tell us what that $300,000 would do?
Yeah, so it was AHD running the numbers for the remainder of the year of all the positions that we were looking to add, from the public health nursing, the epidemiologist, and some other health-related positions. So we just ran the numbers again and came up with that number. So it was a slight increase for the remainder of the year.
Got it. Thank you. Thank you, Mr. Chair.
The next one, and I may ask Chris to describe this one. I know he's had more conversations with a couple of members, but it's the line 27. It's the Public Lands Jobs Program. Like I mentioned, this one was, I believe, $2 million on Friday. It has been reduced to $1.5 million. And I believe that the main reason why that is because as we looked at some of the proposals that different members had brought forward on Friday, and in talking with them over the last week and looking at them, some of those were not as shovel ready as we initially suspected. So that is the reason for the decrease there. But I will give Chris a second to correct me if I'm mistaken on any of that.
And actually, before we go to Chris, I forgot to do one thing at the beginning, which was to ask both Forrest and John to make a couple of disclosures, and then I will go from there.
Well, I'll go first then. Excuse me, this is Weddleton. My wife works as an employee at 9-Star Enterprises, which has $300,000 allocated for CARES Act funds, and that allocation did not come from me, but
and Forrest.
Yeah, as per prior ethics board guidance, I serve on the board of the Anchorage Park Foundation. I receive no compensation for that. It's voluntary. However, I believe that a program was put in, not by myself, last time. And I think the intention is to try to bifurcate those two items when we actually come to the vote on Tuesday. Thank you, Mr. Chair.
Thanks, Forrest. So just like with previous work sessions, I will operate under the same MO, which is if we discuss those items, either the items with 9-Star or the items with the Anchorage Park Foundation, that both John and Forrest can't engage in the discussion on those items. And then on Tuesday, we will go through the formal declaring the conflict and making a ruling. But for this work session, we'll stick with our normal practice. Go ahead, Chris.
Thank you, Mr. Chairman. Just to add some color to what Mr. Buckinson already addressed, subsequent conversations with State DNR and Chugach State Park led to the decision to remove some of the projects that were in those areas because of the lack of time available to expend the funds to actually complete some of the planning and design and permitting functions that would be required to do it. So based on the feedback from those individuals at the state parks, we decided it was appropriate to remove.
Got it. And then, if we can How much more do you have, Jason? Because I have some
I
members.
just have a 3 or 4 more items to touch on, and that's it in terms of
Let's
changes.
go through that, and then we'll go through the queue. Thanks.
Okay. I will come back to line 37 on here, the contingency fund, and explain that at the end. Line 38 was the next addition. This is an issue that I believe all of the members have received multiple emails from a number of childcare providers that are, while unlicensed, are exempted from needing to be licensed. So it was a very small portion of providers that, because of the way that the $10 million for licensed childcare providers were worded, the legal department and the administration didn't believe we could include them in that. So this is our attempt to put them on the same kind of playing field as the other child care providers that are receiving the $10 million. So that was an add of $500,000. The next two, or I guess the next three, are all things that were removed. The first one was the $2 million for assisted living facilities. Again, in talking to a number of the members that brought this idea forward, while we have heard from one assisted living facility, I think the desire was from the members in the administration to potentially convene a meeting with some other of the facilities to kind of get a better understanding of what the need is, so we could better target some sort of relief here in the near future. So in the meantime, we removed the $2 million pending those conversations. The next removal was for the public restrooms, and the reasons why that is because we went back and had conversations with the EOC about would these potentially be a reimbursable cost from FEMA, and the answer we received back was yes. So I know Chris has been working on this, so I'll let him maybe weigh in just quickly on this before I go on to the last two items.
I'm sorry, I was barely listening to you. Which line are you on? I'm sorry.
The removal of the public restrooms and the fact that we've been talking to EOC, and I wanted you to weigh in on that since you've been having those conversations.
Yep, thank you. So we've had subsequent conversations with the EOC around the mass shelter and the functions at the mass shelter, and whether or not the public restrooms and hand washing stations that are deployed there, we could expand that contract to include restrooms and hand washing stations at areas beyond the immediate area of the shelter. I think the experience that neighborhoods between some of the downtown areas, Fairview, and the creek area surrounding the shelter is that there's a lot of pedestrian traffic coming and going that need access to those restrooms. And so based on that, the EOC thought that that was a reasonable expense, which in turn makes it part of the mass shelter project and in turn eligible for FEMA reimbursement. So we're going to institute a separate project outside of the CARES Act to do that.
Thanks, Chris. And then the final removal is the $500,000 for additional administrative staff. We have spent quite a bit of time over the last week looking at all of these and kind of what our internal capacity was and that of the partners that we have worked with in the nonprofit area to help us push these out. And we believe that we do not need actually any additional internal capacity to do that. So we removed the additional $500,000 that would have come to the administration on that. And then the final addition is the bottom line which is the non-critical transportation services at Sullivan Arena. We currently are providing critical transport, and that is something that is eligible for FEMA reimbursement, but non-critical transportation services to and from the Sullivan Arena for individuals that are there is not a FEMA reimbursable expense. So we have talked with a number of members that, and we agree that this would be a low dollar amount that would be able to provide transportation services to and from the shelter, so that there's not potentially as much foot traffic. So as a result of some of the additions, but for the most part, many of the deletions from there, the contingency fund piece went up about $3 million only in the first payment number. So I believe the number was about 16.8 or so on Friday, and as you can see in this document, it's now about 19.7. But as I mentioned, a couple of the items that we have removed will potentially be additions here in the near future as more work is done on each of those items. So other than that, the administration appreciates all of the collaborative work that went into producing all of these items, and we certainly agree with them and look forward to the conversation the rest of the day, but certainly on Tuesday night, so that we can begin to push this funding out into the community. So with that, happy to answer any additional questions or listen to comments.
Great, thanks, Jason and Chris. I'm going to go ahead start going through the queue. So right now I have Crystal, Jamie, Meg, Chris, and Austin. Start with you, Crystal.
All right, thank you. My question was on the specifics for the public lands job programs. You mentioned some were excluded, so I just wondered what was still on the list. Thanks.
Yeah, thank you. Through the chair, the public lands program is focused on some Eagle River and Girdwood projects, and then Eagle River, the two that we have shared with this group that are shovel ready or construction ready include a roof replacement program for the Eagle River Nature Center and the brushing program that's proposed for Eklutna. And then in Girdwood, there are two separate shovel-ready trails projects that are escaping me at the moment, but one of them I know for sure is on Old Iditarod, and then the second one I'm forgetting exactly where it is, but they were projects that were nominated by the Girdwood area manager.
Okay, thank you. So they did come up with a more reasonable estimate on the roof at the Nature Center?
Through the chair, no, actually it's gone the other direction. It got more expensive the more people they had look at it. But the offshoot of that is that it's now recognized as a much more pressing need and something that probably needs to happen immediately.
All right, great. Thank you. Thank you, Felix.
Thanks, Crystal. Jamie?
Hi, thank you. I'm not sure who can answer this question, but can we roll it back up so I could see the slide for line 22, please? Thank you. So first responders payroll reserve. I had a little bit of input from the federal government on this one. I would like to find out where the documentation and what the plan actually is. I have only heard that the administration adamantly wants this to stay at 21 million, but I would like to see what the plan in writing. I'd like to see what it's for. So can I get some paperwork so I can see exactly what it's going for and how much and the broken down, the analysis, please?
Through the chair, Assemblymember Allard, yes, we can certainly get that to you.
Do you think you'll be able to get it to me by close of business today?
I don't know if close of business by today, but certainly well before Tuesday evening.
The only reason I'm asking if I could get it by close of business today is because you have it on there. And if it's already a plan that you guys have established that you want the money to go to, I really want it to go over it. I know other people have asked for it and I just haven't seen anything. Thank you.
Thanks, Jamie. Meg?
Thanks, Felix. I wanted to talk about the $500,000 for the non-covered childcare. I believe it was down in the mid-30 lines, if I'm not mistaken. So the idea was that unlicensed childcare facilities but that don't have to be licensed, were exempted out of that first $10 million pot, and that was based on how we worded it. If that's true, okay, great. That's good to know that we have that gap. But what's the makeup of this grant assistance? And can you tell me a little bit about what's an exempt child care facility, and how much per facility we're talking about?
Yes. So through the chair, Assemblymember Zalatel, Nicole Lebo on the health department, I don't know if she's on here, can provide a lot more background on this, but there are, I believe, about a dozen exempt childcare facilities, and I think the reason that they are exempt is a thing in state statute that doesn't require them to be licensed, but they are considered to be exempt from needing to be licensed. And like I said, there's about a dozen of them in our community, and the same exact program would be applied to these providers that are being provided to the licensed childcare facilities. So the difference that some of these facilities would receive in this funding will probably be the same difference that a lot of the licensed facilities will receive in overall funding within the other program.
Mr. Chair, can I ask a quick follow-up?
Go ahead.
Thank you. So I just took 12 into 500,000. That'd be about $40,000 a facility. So we must be talking about some kind of facilities that aren't small in-home care, but are larger facilities. I need a tiny bit more context, and I can follow up with Nicole as well, but that seems like a lot of money for 12 facilities.
Sure, but I will just give, through the chair again, I'll give you some context to the 10 million as well, which is there are only 247 licensed facilities in Anchorage, and if you divide that number by 10 million, you get to roughly the same number, which is about 40,000. But again, because the way that the program is set up, and it's based potentially on the number of students that each of the facilities actually care for, the difference isn't going to be as simple as each facility is receiving 40,000. There might be one that receives significantly more than that based on the number of children that they care for the other way. So certainly let's follow up with Nicole, and she can get you a lot more detailed information on it, and that's about the extent that I think I can intelligently discuss.
Thanks. Chris?
Thank you. So we're having a meeting this afternoon to talk about the line up above that is the $7 million for our hospitality folks. And of course, they're valiantly making an effort to demand $21 million from us. Very frustrating because the governor continues to sit on $290 million. And I just am looking at this list to see where people are going to pull that money from if they intend to move to $21 million. And I'm hoping tonight's discussion or this afternoon's discussion is narrowly constructed around the 7 million, and that we come back on Tuesday after a public hearing and hearing from everybody from the public and make our determinations based on that. But the areas that I see are fungible are the Girdwood Health Clinic, Covenant House Project, all of the Visit Anchorage money, the Eagle River Nature Center, and monies from the rent and mortgage programs. To me, that seems to be where that money will come from if there's a move a foot to make an amendment. So I just want to put that out there.
Thanks. Austin?
Thanks, Felix. So was all of the Indigenous placemaking removed, including the 40,000 for the plaza, or where does that fit into your proposal?
Yes, through the chair, the shovel-ready project, the installation of the plaza that can happen this year is part of that package that you see on line 27.
Okay, and you removed the rest, and can you describe why?
So the balance of the proposal from the Parks Foundation for purchasing 30 more signs, posts, et cetera, is something that we at Parks and Recreation Department have talked about incorporating into our annual capital improvement budget and doing through the traditional bond path forward. There also was some discussion about whether or not the shovel ready, getting people back to work sort of matrix that we've set up for the public lands program would be fully satisfied with that additional $300,000 ask. And at the end of the day, we thought it would be best to move forward with the shovel-ready construction project and then move the capital acquisition stuff to a different funding source.
And so if we don't include it here, are you committed to putting it on the bond for 2021?
Through the chair, yeah, I believe it's 21. I'll have to look at the CIB, which I don't have open in front of me, but I believe it is next year.
Okay, and my understanding is some of this, I mean, I think shovel ready is maybe the wrong term because there's no shovel necessarily in making the signs, but that there are local artists who also could use some employment, and that this would both, honor the Dena'ina people and put people to work, and that there's work to be done in 2020. So is that not your understanding?
So through the chair, it is our understanding that the request for the 30 additional signs would produce the materials this year, but they would not be installed this year. So the as you put it, the shovel-ready portion of it is predominantly in out years. As for the costs associated for constructing them, it is true that the signs are fabricated out in Palmer by a fabrication shop out there, and part of the overall budget as proposed by the Parks Foundation does include funding to pay for some art and other consultants as part of that process. But we ultimately believe that it's actually something that's more appropriate in the bond package because of the reasons I just described. So we felt it better suited for that funding source and not for CARES Act dollars.
Okay, it would be helpful to know before Tuesday whether you're committed to putting it in the 21 bond. Chris, can you guys hear me?
Yep.
Okay, can you get that information for me before Tuesday?
We can do that.
Okay, great. Thanks, Mr. Chair.
Thanks. Crystal?
Thanks, Felix. I had a couple of questions. Now, if I remember all of them. One of them is in specifically the Chugach Eagle River Chamber of Commerce. They have officially canceled any form of the Bear Paw Festival now. So where do they fall into some kind of grant?
Yeah, through the chair. We were, of course, saddened to see the cancellation of the Bear Paw. Chugach Eagle River Chamber is a not-for-profit entity that would be eligible for the nonprofit stimulus or relief package as proposed on line 31.
Right.
And so we want to work with Brian and Debbie and team to make sure they're aware of that and get them into the queue.
Okay, and will there be certain amounts that are already will there be maximum amounts, or is everybody just applying in that particular group of funds for whatever they feel like they need, or how is that going to be actually distributed?
Through the chair, yes, great question. The formula or the methodology used for the nonprofit relief will be different than the pilot program that we did earlier this summer. And part of the reason is because we've learned from that experience that a flat grant amount is not reflective of the different business types that are out there, particularly in the nonprofit world. And so working with our partners at Foraker Group and others, we are looking at a nonprofit grant program that is scalable to the size and functions of each individual nonprofit. And so for the Chugach Eagle River Chamber, that would be the grant amount would be a function of that equation.
Okay, thank you. And so there hasn't been any talk about how you're going to put limits on those particular allocations yet.
Through the chair, there will be limits, but the current proposal is to develop a system that provides relief that is scaled to the size of the organization and the income of the organization. So while we can't say that the Chugach Eagle River Chamber would be eligible to receive, pick a number, $100,000, the grant awards that they would be eligible for will be reflective of what their annual budget is. There's a big difference between a nonprofit like the Chugach Eagle River Chamber and, say, AEDC, for example, which is a much more significant nonprofit entity.
Right. Okay. All right. Okay. So I had another question then, Felix, if I can. So.
Yeah, go ahead.
Oh, thanks. Just going back to the first responder payroll reserve, and I still am trying to figure out why this is an eligible use of CARES Act funding. So can you, and maybe you've said this before and it's just not registering with me, but again, this doesn't sound like an actual expense. It sounds like a potential expense that we'll have in the future, and we're trying to save funds for that. So anyway, I just really need a better explanation of what this is about. Thanks.
Hey, through the chair, this is Alex Slivka. So I will read exactly what Treasury Guidance is. And it states, public safety and health labor expense is presumed to be CARES eligible for this reason, and as a matter of administrative convenience in light of the emergency nature of this program, a state, territorial, local, or tribal government may presume that payroll costs for public health and public safety employees are payments for services substantially dedicated to mitigating or responding to the COVID-19 public health emergency. So what this 21 million represents, remember, we spend close to 170 million a year just on police and fire labor. So we allocate 15% of that, that's $21 million. And so that is what this, and hopefully this maybe answers Jamie's question as well. This 21 million represents a percentage of our police and fire labor costs, which are completely allowed as an applicable CARES grant expense.
And can I follow up on that, please, Mr. Chair? So.
Sure, last one.
Thanks. Okay, so in terms of how we actually came to that number, aren't we still presuming? I mean, you're talking about presumptions. So are we already on some kind of a track that says we're going to spend this amount, or we're looking at a trend line and potential? I'm still trying to grasp how we really came up with the number. Have we already spent this much? I mean, are AFD and APD already over budget at this point?
So again, they are not over budget. So they have an existing budget, which they are in line with. So what the CARES Act grant directions from the Treasury allows us to use these expenses, which you have already approved in your budgeting process. We're going to apply those expenses, which, yes, I mean, we are several months down the road. We've incurred tens of millions of dollars in police and fire labor expense easily. We are going to apply those expenses toward the grant, and the outcome of that, which we have talked about a number of times, is that the fund balance at the end of the year will reflect that transfer of money that, you know, initially was budgeted to be paid for by taxes, now is going to be paid for by the CARES grant. I don't know if that answers your question specifically.
Yes, it answers my question. It doesn't necessarily answer the real philosophy behind it, but we can talk about that later. So thank you. Thank you, Felix.
Thanks, Crystal. Suzanne?
Thanks, Felix. Three things. And the first one, Chris Constant spoke to, and that's the small business stabilization for $7 million. And I know we're going to be taking that up later. And I'm assuming that's when we'll be talking about details and rules concerning accessing the money. And I agree that, or I believe that we do need to be looking at where we can take additional funding for that line. I know there's a proposal coming from members of the hospitality industry to increase it to 15 to 20 million, and just to cover the costs incurred from the from closing in-room seating for bars and restaurants for August. So I do think we need to be prepared to find, you know, where we're going to take that money, as Chris mentioned. From the second one, the Public Lands Jobs Program, I've not been involved in any conversations with the administration, so as to follow-up information on some of the projects that were proposed. So I am surprised to see that that has been reduced, and I am hoping that I can become a part of those conversations, as there are projects that are shovel-ready in the district, besides the one in Girdwood, which I'm very happy to see on the list there. So hoping to come back to that one. And then finally, on the Awake item, I'm pleased to see that that's on there for $600,000. I just wanted to speak very briefly because last Friday I did not have details, and there are actually two parts to the proposal, and I do have a question at the end for the administration. And the first part actually is emergency shelter, since Awake has seen an increase in overall crisis calls by 43% in the last few months, and then a demand for emergency shelter go up by 75%. At the same time, their sheltering capacity, because of the CDC social distancing guidelines, has been reduced from 52 to 29 individuals. And so for the past few months, with donations from foundations and corporations, they've been able to provide offsite housing for a short period of time. And they have, however, the funding for that has been depleted, so they can no longer do that except for male victims, who cannot be housed at their current facility. So the cost to continue to provide emergency shelter is estimated to be about $100,000, and that's based on 5 people times $139 a day, for a daily cost of $695 times 143 days remaining in the year, which brings it to about $99,385. So that's the emergency shelter piece. And the second piece is a facility renovation that Awake is completing, which is estimated to be $600,000. And that would add more space to their current facility. It would add 15 beds, 3 rooms, so they would increase their capacity to 67 persons, and they would also be able to house male victims. So those are the 2 pieces of the Awake request.
And I wanted to ask the administration, the emergency shelter component for $100,000, is there another source of funds available, CARES Act funds, for that piece of it? Thanks. Thanks, Felix.
Thank you, Mr. Chair, through the chair, Assembly Member LaFrance. Yes, we again had a lot of conversations with the EOC, and are some of those items that they are experiencing, are they eligible to get those reimbursed through FEMA? And again, the answer that we received is quite likely they are. So we will follow up with the executive director of Awake and connect them with the correct individuals so that they can go through the process of getting those costs reimbursed. And that is the reason why you do not see the $700,000 associated with this line item, but only $600,000, because we do believe that they can be reimbursed through a different program.
Great, that's good news. Thank you so much. Thanks, Felix.
Thanks. Next, I have John.
All right, thanks. I don't come as well prepared as some with any dollar amounts, but there were a couple ideas that came up at a new items that came up at a South Anchorage Town Hall on CARES Act funding that Suzanne and I hosted a couple of days ago. And one was kind of interesting idea. I have no idea what it would cost, but it would be some funds to subsidize store delivery for people who are high risk. And that's, I know it's something to consider. I don't have a dollar amount for it. And then another was also interesting is, we're doing a lot with homeless, but we know a lot of some number of homeless in Anchorage are here because they got here and they can't get back where they want to be, back home. And some amount of money for one-way tickets back to where they would like to be. And that could have a very quick, direct impact on the number of homeless in Anchorage. And then kind of a broader thing is I've looked at this, we've gotten this $21 million request from the hospitality industry. And I think they have, kind of good grounds for ask for it. They've taken kind of a, undue burden compared to other, businesses and so on throughout this pandemic. And, but at the same time, the amount that they've requested, kind of the formula and with a cap at 35,000, in terms of a business, that's not a lot. I mean, that's just buying them a little bit of time. They're closed for 4 weeks. I mean, the losses are vastly more. So we have this huge amount, percentage-wise, of what we have available to spend, and unfortunately, it does relatively little for those businesses. And I was wondering if we're kind of maybe hit this in the wrong direction. And, we had in March, hunkered down, businesses were closed, and it was to buy time to enhance our medical facilities so that we would be able to handle, a large influx of, hospitalizations due to COVID-19. And essentially that's why we're starting back on this route for more closures, is because we expect sometime in mid-September that ICU beds will be full. So the $25 million to help the businesses is a relative pittance, but I just wonder if $25 million would buy us, dozens more ICU beds, and increase that capacity so that, we wouldn't have to have these closures. So, kind of lift the closure restrictions and say, okay, well, we bought, 30 more ICU beds and perhaps other health capacity, and made a real difference instead of just giving a pittance to these businesses. So that might be, maybe the administration could address that.
Through the chair, Assembly Member Weddleton, I will attempt to. I believe that in regards to our abilities to purchase additional ICU or ventilators or things like that, I think are, again, somewhat limited based on the production of those types of items, very similar to the same type of backlog to a lot of PPE. But we can certainly track that information down and see what that timeline or time horizon would be if that was something that was of interest for us to pursue. But that's my extent of knowledge right now, is that it just is not possible based on production of these units and the need, not just here, but across the country.
Okay, could I follow up briefly?
Sure.
Okay. Another point. So that. Well, thanks, Jason. Whatever. And I sent out some emails trying to find out answers to those that just haven't heard back yet. Another thing, to the extent that lack of ability to do contact tracing is one of the reasons we would do closures. I expect that you could probably get every bar in town to donate an employee to do that. And, if you want social workers to do that, the best social workers in town are bartenders. Thanks.
Certainly, again, through the chair, I think that is something that we are actively pursuing and trying to find as many contact tracers as possible. And I will also add a little bit more context to your first question, which is to say, while getting all of this equipment would be great for the community, I think a larger issue that is still outstanding, and something that has been in a lot of the documents that have been put out about some of the reasons why our hospital capacity and things like that have moved into the red, doesn't necessarily have to do a lot with the actual availability of rooms or beds or ventilators. It has more to do with the amount of staff that we have, that the community has to actually run those machines and those beds. So we can certainly have all that we want, but if we don't have sufficient staff in the community to run those, I don't know what value that they would actually provide.
Thank you.
Thanks. Jamie?
Yeah, I'm right here. Thank you, Felix. Mr. Lifka brought up my name in regards that you hope that better explained it, and the answer is no. I want it in writing. I don't understand on line 22 with the first responders what the administration is hiding. And if you think getting me the documentation the day of or the day before for the first responders payroll reserve is okay, it's not. And my other thing about that is you're interpreting the Treasury 4-page letter in a manner that, for some reason, I have no idea why you don't want to share that unless you think you have the votes on the assembly to pass it. I'm just going to call you out. I don't agree with political favors. And that line number 22 sounds like you guys are pulling political favors. It needs to be completely transparent so the public knows what's going on. So if you want to give me the paperwork, I'd appreciate it.
Through the chair, Alex Slivka. We will get you the exact data. I would disagree with your characterization. We are utilizing these CARES grant funds to pay for expenses that this assembly approved during their normal budgeting process to pay for the salaries, the existing salaries of police and fire. This does not add 21 million to the salary base of police and fire. It just changes the color of the money that is paying for it. That is all this does, nothing more. And we've sent you a statement. I'll send you the statement again from the Treasury Guidance that was published online May 28th, 2020, and has not been changed, which gives us explicit authorization to use the CARES grant for these types of expenses. And I'll stop there.
Thank you. Next I have Meg.
Thanks, Felix. I hate to be persistent on this, but the exempt facilities for childcare can have a child who attends no more than 6 hours a week. So I would want to look at the proportionality of that, and that doesn't feel like we're aiming towards something terribly equitable, which I know with the other program had been a main concern. So just want to make that comment, and then we can follow up offline. But the voucher pilot program there on line 41, is that the ERTF or the ERTF's recommendation? And if so, did we figure out how to tie it to an eligibility? Because I know that that had been kind of the crux of figuring out how to administer such a program.
Through the chair, Assembly Member Zalato, yes, this is the ERTF recommendation. And one of the reasons I believe that the ERTF actually proposed this at a significantly higher amount. And the reason why it is in this document and proposed only for $1 million are for some of the exact reasons that you raised. We want to make sure that we figure out exactly how we will be able to do this and tie it to some actual demonstrated need. And that is something that we are actively pursuing, both with the members of the ERTF and others as well.
Thank you. I appreciate that. But I'll tell you, unless you know more specifics, this is a no-go for me, because we've been asking to try to figure out this piece with stimulus or vouchers, and we've provided some ideas. So unless we kind of develop it out, then fund it, I'm really hesitant when we have some requests that we know could bolster just keeping people in work and other things. So thank you.
Thanks. So I'm next in the queue. Couple things. First is maybe I missed it, but did the administration send us the? I think you all were gonna send us like a description or something regarding the healthy public spaces unit, if I got that right. So has that been sent to us, and if not, when will you send that to us?
Through the chair, Assembly Member Rivera. No, it has not been sent, and it is one of the reasons why we pulled that request out of here, because we have not had the time to fully complete that. But once we do, we will certainly share that with the Assembly.
Great. Multitasking, apologies. So second is, so this is sort of more of a general question, and I think it relates a bit to a lot of the jobs programs that we have in here. So just sort of generally, how are we going to make sure that the programs are doing what we intended them to do? I know for some of them, we get regular reporting back, like the rental assistance, the small business assistance, but some of these other pieces, we really haven't, because they're new, we really haven't talked about that. So could you talk a little bit about how we are going to hear back from the administration or whoever the providers are that are selected about making sure these programs do what they're supposed to?
Sure, great question, Mr. Chair. And I think part of the answer is that, at least from my perspective, is it will be somewhat similar to kind of the regular updates that the body receives in regards to the small business grants, the rental relief grants, and then, I know that there have been some early updates on the child care assistance grants and where we are in that process and whatnot. So I would envision that the same type of regular updates would flow from the administration to the Assembly on each and every one of these jobs programs, to include how far along are we on the individual projects, how many people are we employing, and what is an end date for each of the projects. But that's, I think, the answer that I would give, and I'll ask if Mr. Schutte has anything to add. But
thank you. Through the chair, my answer would be mostly the same as Mr. Bockenstedt's via the weekly reporting tool. I will point out too that on a couple of the proposed packages, there are partners in the community that we're working with who are also providing information through press releases, et cetera. So I guess in the example of the Small Business Stabilization Fund that we stood up earlier this year, the partner that we worked with, Cook Inlet Lending Center, they had a communications plan for the project, as did the municipality, so that we could report out not just to the assembly but to the public about the impacts of the programs. So I would imagine that in some of these where there are partners in the private or nonprofit sector, that they also would be participating in the data collection, reporting, and communication. And then some projects, not all, but some lend themselves to a final report, if you will, kind of like being back in high school. So we provided that for the Cook Inlet Lending Center, the 1 million stabilization project, and I can see that being a similar grant requirement for some of the others in here as well.
Thanks. I think for my part, besides final reports, I would emphasize what Jason was saying earlier, which is more regular reporting, whether that's in our weekly reports or otherwise. Particularly, I think we'll get to this after we're done with the queue, but I want to make sure that we are achieving the goals as outlined in the framework that we've developed and those guiding principles. And so I think more regular reporting will help us to determine that. Appreciate that, Chris and Jason. Next, I have Forrest.
Thank you, Mr. Chair. A few things, in part in response to Mr. Weddleton, and what he relayed from some of his constituents. First, I'd just like to say thank you to the administration for bringing this to us. I'm not sure if that's been said yet, but this is, 95% of what we came to an agreement on last Friday, and it's actually pretty remarkable that we've gotten this far through a long process. And I appreciate you bringing us another draft, and that it largely looks like what we asked for, with some differences, but largely the same. On the one-way tickets to the Bush idea, just for folks that might get that request in the future, I was part of a nonprofit that called Forget Me Not, that was Indigenous-led and specifically raised money and airline miles to do that for folks that voluntarily wanted to. And it turns out it's actually not hard at all to get those funds. That is not the issue. The issue is knowing how that person can be safe, what they're going back to, if they're going to have housing when they get back there, if their community will accept them. And then, of course, identifying who is and is not actually, quote unquote, from rural Alaska if they're living in Anchorage. It's much more difficult than you think to administer. And actually, the cost of the tickets is just an afterthought. You can raise that we could raise enough airline miles in 20 minutes to get a person back to their village once we had all those other things figured out. So I just don't think it's a realistic option. The thing on the idea that contact tracing and ICU beds is really the limiting factor, I think leaves out the fact that if you just let the disease sort of burn through the community, then you can't do things like safely open schools. And you also tremendously increase the chances that someone with the disease comes into something like the transitional care facility in my district that led to 2 fatalities in the summer. And so that also I don't think is very realistic. And I guess the last thing I'll just say on something that Mr. Constant alluded to, if we were going to help small businesses in a really substantial way, and I say this a little bit tongue in cheek, but if I was going to add another amendment here, it might be, say, $250,000 for a short-term media team, a public service announcement, and a lawyer to try to get the administration to free up the state administration to free up the $290 million that is currently trapped in bureaucratic red tape and hasn't been distributed, even though they have the authority from the legislature to do so, and let the public know that that's happening and get the media to cover that story. If we want to make a meaningful impact, we have to be telling the story that there is a huge pot of money out there for small businesses that just isn't being distributed. So sorry, there's no question. Thank you, Mr. Chair.
Thank you. Chris?
Yeah, thank you. Interesting, this talk about blue tickets and helping people get back to the villages. And I have long suggested that what we need to do is open an Office of Rural Affairs and actually pay a staff person and maybe a small team to build linkage in our hub communities and rural communities that would actually help to facilitate and build bridges for these communities and individuals back and forth. But I don't think that's in the scope of what we're doing here. And I think that it's just a fraught with peril idea to start allocating big funds to just move people out of Anchorage. We need to solve the problems we face with our own solutions. Now, there's one element that we put funding forward for, and it was $50,000 to help us communicate with the public on this CARES Act monies. And we're now 52 hours away from public hearing and vote on the question of how we're going to spend these dollars. And I had hoped a week ago, 5 days ago, we would have had this information. No, not a week, but 5 days ago, Monday. So are we still proceeding on that? And in what shape is that going to take? Because at this point, the train has pretty much left the station.
Thanks, Chris. I have been emailing about that during this meeting and for the last how many days? So there have been a variety of issues that have popped up. The first one being the PO that needed to get done, and then some other technical issues. Long story short, we are working on getting this out today and doing as much sort of media and other things that we need to get to. I appreciate that you wanted it last week. I wanted it last week too. Things did not pan out that way. I will also say, just in case anyone is curious, the expense for this is going to be much lower than that $50,000 amount.
Thank you. That was definitely going to be the follow-up question. It just begs the question, is it worth the investment at this point? And so, but if you have a rational basis for how much you'll spend, then I'm not worried about it. Thank you.
Thanks. Meg?
Thanks. So as we look at amendments maybe coming today, and we have this before us on Tuesday, and this all works together, I guess the process question then is, are members preparing to identify, or is that maybe a request, or maybe it's a request for me, where additional funds are coming from? Chris alluded to this earlier, because we're gonna need to then, we need to balance our ledger in the end. Of course, there's still the money in the contingency pot, and of course we can discuss that, but I'm just trying to think through the easiest way we can communicate with one another as we take up these two separate but very related actions. So I just wanted to toss that out to have folks thinking about, or if they had specific ideas, or if you had specific requests of us, Mr. Chair.
Meg, so just to clarify, you're asking specifically if folks are going to have amendments to this?
No, what I expect is there will be well, yes, I expect there will be amendments to this, but I also expect there might be amendments this afternoon, and making sure that we don't lose track of one action we've taken and how it may affect the next one.
Thanks. Yeah, and so I don't have a crystal ball, so I can't tell you what's going to happen at the meeting this afternoon. It's each member is going to do what they see fit. But we can repeat this again at the meeting at 1:30, that whatever decisions we make at the meeting at 1:30 are going to impact the decisions that we make on Tuesday. I would suggest that if any members have amendments that they're going to make on Tuesday, it's probably a little too late for the 1:30 meeting, but if you have amendments that you're going to make on Tuesday, that you should get those distributed to the administration and to the assembly ASAP, so that we will have a chance to deliberate any of those items. And I think at the latest, if we can have amendments by Monday, that would give us at least that overnight, Monday to Tuesday, for us to consider the entire package again. If there is a need or a desire for us to meet again to do a second work session just to talk about any amendments, we could look at scheduling that either on Monday or Tuesday before the meeting.
Thanks for that, Felix. Maybe one of the easiest things to do, just so that we can all be literally on the same page this afternoon, is that we could have copies of this spreadsheet with us at the meeting today, and then or we have it via email, so that if we want to make notes or as we kind of talk about things and hear the intent, if there are amendments, we can keep track.
Thanks. Yes, we can make sure, and I don't know, Desiree, if you can make sure that we have copies of the spreadsheet or the administration, that'd be great. Okay, so I'm going to open it up one more time for any questions. If there's not, I'm going to move us on to the next part of this work session,
Mr.
which
Chair.
was just to go over the framework one more time. Yeah, go ahead, Chris.
I just would want to put into the record here, if folks haven't found, the courts ruled that the restaurants must shut down.
Thanks, Chris. All right, so not seeing anything else, I am going to go ahead and share my screen really quick. Okay, so just wanted to briefly open up the discussion on the framework. Particularly wanted to see if any members had final thoughts on the framework, as well as wanted to see if members felt that the proposal as it currently stands is an adequate representation of the priorities and the guiding principles. Because I'm sharing my screen, I can't see the chat, so I'm gonna have to rely on either Austin or Desiree to manage the chat. Rather, manage the queue.
Sounds good, Mr. Chair. I don't see any questions yet.
Thanks. So I just wanted to take one last opportunity, make sure that we're all good with the list as it relates to the framework. I'll give it another little bit.
Ms. LaFrance?
Thank you, Austin. Thanks, Felix. I just wanted to comment. I think the framework looks really good and is helpful. And by putting economic stimulus as the first priority, there's definitely an expectation from the public that that category will, or at least the public John and I met with at our meeting on Wednesday, that category will have most of the funding allocations to it. I don't know what the total is offhand, but I just wanted to make that comment because the feedback that we got was the proposed allocations did not reflect the priorities as we had listed. Thanks.
Thanks, and sorry, I can't see the queue, so I'm just going to jump in. And perhaps we just need to clarify. So no, the priorities are not ranked in any type of order, but I can totally understand why a member of the public would look at this and see economic stimulus as top, family support as second, housing and homelessness as third. But that was not in any of the discussions that we had. So if we need to clarify that and, put something under priorities, parentheses, not in any order, we can do that.
Actually, I think that might be helpful. Thanks, Felix.
Felix, we have a question from Meg.
Thanks. Thank you for the clarification too, Felix. I was going to ask that I didn't think that they were in any priority order, but I think we need to do a really good job as we communicate out the S version, I believe, what the funding addresses in the priorities, because there's a lot of overlap there. I think a priority that may address housing and homelessness might also have economic stimulus and support families. I don't want to look at these priorities as siloed in any way. They're all what create kind of livable life for folks, and that a lot of these things have to work in concert with one another. So to the extent that we can be communicating that, I think will be really helpful. And it'd be really helpful as we move forward with the public and this framework and put forward these specific programs is kind of what's the timeline on the implementation of some of these. I think I've gotten some frustrated feedback from the public. Oh, hey, you're going to do this program and then it's, a month or a 6-week rollout. I just want to make sure we're being very clear on conveying expectations and when the funds will likely become available, or the application periods and then the funds, because those mechanics, I think, are getting already stressed out people even more stressed out. Thanks.
Felix, did you want to respond at all, or should I move to Chris? He's the next one in line.
I don't know if that was a question for me. That might be
Okay.
more a question for the administration.
Okay, cool. I just didn't know if you were trying to manage responses. Okay, go ahead, Chris.
Actually, I'll pass. Thank you.
We don't have anyone else in the queue right now.
Great. I'll stop sharing my screen then. Okay. So let me just double check. All right. So not seeing anything else then at 1:30, we have our special meeting just to deliberate the small business grants. And then like I said earlier, we should do the best that we can to share any additional amendments or thoughts before Tuesday. That way Tuesday can be productive use of our time at the meeting. Otherwise, I'll just open it up one last time. Any final thoughts? So I'll just read the comment from Mr. Slifka. So by my math, economic stimulus and jobs programs are proposed at 49 million. Thank you, Mr. Slifka. Just gonna wait another little second.
Yeah, if I might, Felix, to that point.
Yeah, go ahead.
I have been waiting since Friday to have a spreadsheet version come forward that has them rolled up into the priorities. So you'd have priority 1 and all the projects under that listed, priority 2 and all the projects, not just the way it is now with that column, but a really bold header so people can see the comprehensive nature of this funding. And it's proved to be impossible in a week to even get that. Thank you.
So, Chris, maybe I'm wrong, but we did send you some information, all of the Assembly members, information earlier this week that had that information. So
I'm suggesting it was a presentation version because it had it in a column and spread out. We failed an opportunity here to push out that we've planned to appropriate, like Alex suggested, $49 million in economic stimulus and jobs. That's a message. 5 here, 2 here, 1 here, 500,000 here. That doesn't actually do it. And so I don't know what our friends at Northwest Strategies are intending to do, but I sure hope a big part of that is showing these rolled up categories so people really understand the scope and scale of what we're talking about.
Thanks, Chris. With that, I'm going to go ahead and close the work session.